Hey everyone, my name's Brett. I'm a burnout nurse, recreating beyond the bedside. And whether you're powering through the night shift or holding it down during the day, we see you. But let's talk about what's really going on in healthcare and in the workplace. There's violence, there's payroll messes, and there's burnout, and they're all hitting hard. And it's affecting your quality of life, both on the job and after you're done with work, when you go home and you assume the role of guardian, uncle, aunt, mother, father. So here's the tea. It's real. And it's now. Healthcare workers are 5 times more likely to face violence than other industries. And a 2023 CDC report showed workplace harassment for healthcare professionals has jumped from 6% in 2018 to 13% in 2022. Verbal abuse, right? Distinctions here. There's all different kinds of abuse. Verbal abuse. A staggering 83.1% of healthcare workers in some regions have reported this. Those are just the ones who've reported it. Report it. A wise nurse once taught me, what you permit, you promote. This isn't just a stat. It's stress, fear, and trauma piling up. In October of 2024, a nurse in Ohio was physically attacked by a patient during a routine check, suffering a concussion. The hospital's response? We're investigating. End quote. This echoes the January 2024 assault in California. Violence isn't a one-off. It's a pattern we can't ignore. So ask your manager. I'm serious. Go up to him and ask him, whether it's after the shift, if you're working night shift, or in the morning. After that Ohio attack in 2024, what's being done to protect us? Are there new safety protocols or training coming? Ask them. For payroll. Payroll issues are a global chaos. In the last month, healthcare workers in the US, UK, and beyond are reporting delayed payments and incorrect wages. Imagine saving lives all night or all day and then having to stress over a paycheck that's late again. And perhaps again. In September of 2024, healthcare staff at a major hospital chain in Texas staged a walkout after 2 pay periods of delayed wages, citing system error. And that's what they were left, unable to pay bills. This follows the UK's March 2024 protest over similar payroll failures. It's not just inconvenient. It's disrespectful to your grind and what it is you're putting up with, if you want to put up with it. So what can you ask your manager about this? Well, how are you fixing payroll delays like the Texas mess? Can we get a timeline for reliable paychecks? I'm sure there are KPIs for your own work in the workplace as a nurse, as a CNA, as environmental, as a greeter. And burnout. Drained at work, empty at home. Burnout's the silent killer of healthcare morale. In 2022 alone, 46% of healthcare workers reported feeling burnt out often or very often, up from a 32% in 2018. It's not just exhaustion. It's them losing themselves to long shifts while being understaffed, being emotionally overloaded, and making it tough to show up for their family or even themselves on a day off, or a significant other or partner. A survey from the American Nurses Association found that 60% of nurses considered quitting due to burnout in August of 2024, with many citing a lack of mental health support after traumatic patient interactions. I've had them. I'll declare it to you. And I charted it. And I let management know. This isn't toughing it out. It's a crisis. So, and for this, what can you ask your manager? Well, what mental health support is available? Especially after the ANA's report showing nurses are drowning. Are there counseling or break policies in place? Nurse-to-patient ratios and staffing being adequate and based upon feedback and patient quality? So I'm going to leave you with this. It's a call to action. This isn't just about surviving. It's about fighting for better healthcare, quality healthcare, timely healthcare, because we will all have our day. I remember myself as a CNA, and a nurse was right there telling a patient who just couldn't take being a patient, couldn't take having a breakdown, couldn't take being human. And her response was that she would have her day too, and she was right. So here are 2 questions to spark change. Take them with you. Share them. What's the latest on the safety in our workplace? What's the big picture? What's the plan to improve it? And ask them, what about this month? Give them measure. What about this month? And keep asking. So with violence, pay issues, and burnout spiking, how are they going to tackle that as a team? Listen, you're not alone. There's power in asking these questions and raising transparency and awareness. Together. I'm going to say that again. Together. We can push for a workplace that respects your night and day hustle. With resources like mental health hotlines, support, consensus support, and in some places, union support. Violence prevention programs that exist and that we use them. See something, say something. So make noise so we can make change. Because what is truly can be happening in healthcare is your stand for a better and being the heroes that lead it.